Hello there, I'm Justin Zaman. I'm a clinical lecturer at University College London and NIHR lecturer. It's my pleasure to introduce you to a series of podcasts called Leaders in Medicine. What this series aims to do is to have conversations with doctors at the top of their fields and to ascertain some of the influences and how they got to those positions. The series has been instigated by Dr Jean McEwan, who is Reader in Cardiology at University College London. Jean, it's my pleasure to have you here to be able to speak to you. Tell me more about your role at University College London and the jobs that you do there.
Okay. I've been at University College London since 1992. I was appointed as a senior lecturer and now I'm a Reader in Cardiology. I also hold an honorary contract as a consultant cardiologist with University College London Hospitals NHS Foundation Trust. Originally, I had an active research group in vascular disease, my main research interest, in which I'm still very interested. But in recent years, I've become passionate almost about education and the need to ensure quality in the training of our medical students and the doctors of the future. One of the things that's very clear at the moment is there is a lot of change in the funding, in how we are regulated as providers of education. And with all that change, we need leadership, because leadership has a lot to do with managing change. And I was undertaking a short course for those people I needed to undertake leadership roles in education. And I realized I didn't have any good examples of people who had leadership roles and were prepared to talk about it. So I started off the series by trying to provide some information for those people undertaking my short course. It's an area where there's a lot of interest. It's really on the agenda at the moment. And really things moved on from there with other people being identified to me or identifying themselves to me as potential role models, as leaders in medicine. And what was also clear is that these were all real doctors, and how they got from being what one might call a jobbing doctor to someone who was managing the changes that we need was of interest to me, and hence the interview series started.
So in the experiences that you've had in setting up this series, what have you learned about the features of a great leader? What makes a great leader?
It's been a great privilege to meet these people, and the one thing I think I have learned is that leaders are really driven by their vocation, not just as doctors, but really as leaders. They are people who recognise a need for change and are not content to accept the status quo and want to contribute and make that change happen.
Now, one would have thought that being a doctor, one has to be a natural leader, but tell me, is there a difference between just being a doctor and beyond that? Is there a leadership role beyond just the normal role you play as a doctor?
I think it's clear that in modern medicine, doctors are team leaders. They're clinical leaders in their practice and often work collaboratively with many others. However, if you're looking at the wider leadership roles, making change happen locally or more widely in the community or nationally, then I think one has to contribute in a slightly different way. The role of a doctor is so all-enveloping that often the people who take on leadership roles in medicine have to modify or give up some of the work that they do in order to concentrate on these leadership roles. That's sometimes a sacrifice because intrinsically they want to be doctors. So it can be quite difficult. Also, at the moment, the recognition of the importance of those sort of roles is not clear within the profession, and sometimes not even financially, because in order to receive rewards such as financial rewards from private practice or from intensive clinical practice, one needs to invest a lot of time. And if one swaps that time for time invested in leadership roles, then sometimes those financial rewards actually aren't there. So while I would say that that's never addressed openly, I think there are things that stop some of us considering taking on these bigger leadership roles.
So as part of this series, you've met lots of leaders in their field. Is there a secret formula to becoming a leader, or In your experience, having met these people, are there different experiences, routes? How do they get there?
Each of the people who've been interviewed have given us a personal insight into their own experiences that have taken them to the point they're at now. Sometimes it's been via a non-traditional career pathway. Sometimes it's because of a very personal life experience. And sometimes it's because of things that they've seen as doctors that have been unsatisfying and where they really wanted to see things improved. And driven by that need to see improvement, and often because of those personal qualities that enable them to take things forward, they've then developed a leadership role, starting small and building up gradually. Many are through the academic pathway, but some are not. Some start and finish as NHS consultants.
Tell me how women fit into this series as potential leaders in medicine.
It's very interesting because, of course, now 60% of medical graduates are female. This year, for the first time, there were more female consultants appointed as first-time consultants in the NHS than men. But still, women are really not well represented in the higher leadership roles. There are, however, a lot of women out there who are doing a fantastic job, but there aren't enough of them. And two documents last year, one was the Chief Medical Officer's report and another called Women in Medicine from the Royal College of Physicians, highlighted the need for more role models for women in higher leadership roles. So I thought, having started this series of interviews, that we might expand it to look specifically at women as role models in medicine, leading change. And that's a sort of subsection of the series now. So it's an important issue. I think that we have to address it, and we have to encourage women with all their other cultural, social and professional responsibilities to take on these additional pieces of work.
Jean, thank you very much for having this conversation with me today. It's been very interesting and enlightening, and I certainly look forward to the series of podcasts that will come about soon.